Where you guys sit is where a lot of other professions sit in healthcare today, and that is we're not going to go through reform, we're going to go through transformation. While we're sitting here today, every 4 seconds somebody else moves to Medicare. That's going to be an extraordinary impact on what we do. And it's not going to be the health delivery system that you are comfortable with today. Forget that. 5 to 7 years, they're not going to be market forces. It's going to be the heavy hand of the government cutting reimbursement, cutting reimbursement, cutting reimbursement, and then we're going to hit the tipping point. Population health management, it's going to fall in a lot of it in your laps. You're going to have to be the kings and queens of data management. If you wanted a seat at the table, you're going to have to earn it, and you're going to have to earn it by delivering value. And it's all going to be about these things. You're going to have to be flexible. You're going to have to get out of the box and get out of your comfort zone, and you're going to have to be innovative. If you can't do those things, you're going to be irrelevant.
Are they doing anything with it? Are they looking at population health management? Are they looking at the data to say we're seeing in this area a high number of type 2 diabetes? What are we doing? Are there any wellness programs that we can recommend to the community to help reduce that? And obviously, in some respects, yes, it reduces revenue. I hate to say it for hospitals, but in the long run, it'll be great for the community and promote that hospital because they're trying to help the community. But it's things like that. Really, how do you take that data? So I really think in graduate programs, it should be more about data analytics, but strategic data analytics. Biggest problem on CEO's desk, and John can elaborate more as well, is the Medicare cuts. What's going to happen? And if you could be able to start to show where you can save money because they know they're going to lose money, that would be a huge message.
You're going to have to start educating people on the hospital side, doing what you can do for them. I want you guys to really get out in front of the curve and set the tone. I mean, who's going to define what you do? You guys, or are you going to let somebody else do it for you? The career that you thought you were going to have when you started school ain't going to be the career you end up with. And if you're not flexible and you're not willing to get outside your comfort zone, it's not going to be as much fun as you thought it would be. I take the view, now that I'm a gentleman of a certain age, I take the view that I'm sorry that I'm going to only work 12 more years. Because, God, this is going to be so exciting. It's going to be so exciting.